So let's move on to scenario E. So you assess a patient with coarse crackles, anterior and posterior, and they have 3+ edema. So that's generally pitting edema, where it's large edema to their extremities or so, and two bilateral lower extremities. So both their legs are, 3+ edema. Their BMP was drawn, and the results are basic metabolic panel was drawn, and the results are the sodium is 142, chloride is 103, potassium is 2.9, their BUN is 7, and the creatinine is 0.7. Glucose is 122, their CO2 is 23, and the doctor orders 20 milligrams of furosemide IV push. What are our options? So you could give the furosemide, hold the medication and contact the doctor, call the doctor, or call the pharmacist. So what are some things that you need to consider or think about here? So what's the classification and medication of furosemide? So as I'm thinking about the class, I know that it's a diuretic. This person has some crackles and they have some edema. So what is their kidney function? Is their kidney function within normal limits? What are the normal limits of the kidney function? What tests do we look at when we're looking at kidney function? So if I'm assessing the patient, I'm looking at their BUN and creatinine, I'm looking to see if it's within a normal range so that I can, whether I do give the furosemide or I don't give the furosemide. So that's one thing to consider, the test. Now, the other thing that we did do a full basal metabolic panel. So the other thing that we actually looked at was their potassium level. So understanding that this is a diuretic, but understanding how the effect that furosemide has on the body and it has on the electrolytes is very important at this point. So I always say where the urine goes is where the potassium goes. So that's something to think about. The potassium level was 2.9. What is the normal potassium level? So we know that the normal potassium level needs to be at least 3.5. So to 5. So when you are giving furosemide, Lasix, and it's going to make it even lower, is that something that you should be giving without even considering or having a conversation with the doctor? Think the worst case scenario. So now if you go ahead and give the Lasix or the furosemide, what can happen to that patient if their potassium goes even lower? What are the side effects? What is the mechanism of action of potassium in the body at a cellular level? So those are some things that you need to, I would think of. So you would hold the medication and contact the doctor. So, and the reason why so you wouldn't just call the doctor and say, hey, I have this Lasix. You want to give all of their lab results. You want to give tell them what it is that you're concerned about. I had this patient with a potassium of 2.9, and I'm thinking of hypokalemia. What are the effects of hypokalemia on the body? And it just doesn't affect the kidneys. It affects the heart rate. It affects the cellular level as well. So where are your normal potassium levels in the heart, in the blood? So hold the medication and contact the doctor for this one.